Good day, ma'am. I am Artist Joy, and I will be your student nurse for today, and I will be assessing the. I will be doing the assessment of the ears. So before I enter your room, I already washed my hands. Can I sit beside you? Okay, this time, ma'am, I will be asking questions. This time, personal health history. Ma'am, have you ever had any problems with your ears, such as an infection, trauma, or ear aches?
Wala.
Describe any past treatments you have received for ear problems. Naa ba?
Wala.
So, family history ta, ma'am. Is there a history of hearing loss in your family?
Wala.
So, isa ma'am, lifestyle and health practices na ta. Do you live or work in the area with frequent or continuous loud noise? Nakapuyo ba ka sa isa ka area nga saba kaayo? Nga sige lang usaba?
Wala.
Do you spend a lot of time swimming in the water?
Sometimes.
How do you protect your ears? Ano man imong ways in protecting your ears? Kung musalom ka.
Wala man.
Pero dili kayo mag-aadto sa lawom.
Dili.
So, has your hearing loss affected your ability to care for yourself? So, wala man kay hearing loss, no?
Wala.
When was your last hearing examination?
Wala.
Wala kay last. Do you wear hearing aid?
Wala.
How do you care for your ears? Kung naman nga kay ways of cleaning your ears unsaon, o yun sa nimo or i-describe sa ko.
Cotton buds.
Cotton buds lang. So, for the collecting of the objective data in the assessment of the ears, you need to prepare the equipment, otoscope, tuning fork, and watch with the second hand. So, first, do the hand hygiene, and then second is the position of the client, a sitting position or supine position for the infants to immobilize the head and inspect the auricle. So, mauni ang auricle. And then the tragus, mauni ang tragus. And then the lobules. So, this one is the lobules. Gani. And then, like every exam, no, first we're going to start with inspection. So, looking at the placement of the ears, looking for the external canal, for any discharge drainage, signs of infection or inflammation. Then, you do and perform the whisper test. So, occlude the ear. So, imong i-cover, or you can cover the ear or let the patient cover hers or his ear. And then, from 2 feet away, start whispering 2-syllable phrase like popcorn, football, baseball, apple, and note client's ability to hear sounds by asking the client to repeat it back to you. So for the watch tape test, have a client cover the opposite ear being tested. So kabila ni mo isa ka adalungan niya, and hold taking watch within 5 inches from ear, and then note the client's ability to hear kung madunggan ba niya ang take sa watch. And then next is the Weber test. You need to have a tuning fork, and then tap ni mo ang tuning fork, and then see for a vibration, and then put it the middle or the center of her head, or pwede po dali sa forehead niya. And then notice the client kung naa ba siya ma-feel ba niya darira or both. So kung both man gani, that means normal lang. So for the rhyme test, all we need is, again, kailangan nato tuning fork, and then we tap the tuning fork and wait for it to vibrate, and then play the vibrating tuning fork. That is a mastoid process. And then note the time until the client can no longer hear the sound of the tuning fork, and then move immediately sa external ear. So paminaw na atong pangutan atong client kung nadunggan ba niya ang vibration dali sa external ear. For the Romberg test, okay, importante kayo niya nga nakasakilid sa imong client during this process or this test. Kay So, ako na-explain. So, have the client stand with feet together, arms at the side, eyes open, and then eyes closed for 20 seconds. And then, uh, note the client's ability kung ma-maintain ba niya yung balance. And kung ma-observe nimo ang iyang swaying, importante kayo nga naka sa tapad. So, if your client loses its balance, makaguide ka sa iya or imo siyang masalo. So, position. So, client maintains balance or position for 10 seconds without swaying or with minimal swaying. Again, for the otoscopic exam, ask the client to sit comfortably with the back straight and then the head tilted away from you toward his or her opposite shoulder. And then, importante kaayo first is always do the talk test to see if there is pain. Ay ka magbutang og kaning otoscope sa imong patient's ear. And then, pag wala man siya nabating of pain, and then start using the largest speculum that would comfortably fit in your patient's ear. And then pull the auricle back and insert the scope. Hold the otoscope like a pen with the handle, up raising hand on client's head using the dominant hand, and then turn the light on the otoscope. So next is, again, use the thumb and the fingers of the opposite hand to grasp the client's auricle and firmly and gently. So, anaon mo siya. Again, to straighten the external auditory canal para dili siya maka-alter sa position during the otoscopic exam. And next, grasp the handle of the otoscope between the thumb and fingers and hold the instrument up and down. And position the hand holding the otoscope against the client's head or face. Kay kani siya nga para ma-prevent mo ang forceful insertion sa instrument, and then makatabang po ka nga mas steady ang imong kamot during the examination. And also makatabang po ka sa client. It is also helpful during sa imong examination kung manggali ang imong client is na mga unexpected moves. And next, insert the speculum gently down and forward into the ear canal, approximately 0.5 in. And as you insert the otoscope, be careful not to touch either side of the inner portion of the kaning canal wall. This area is bony, kanina rin napita. And then, covered by thin, covered ni siya by a thin, sensitive layer of epithelium. So, any pressure will cause the client pain. And then, move your head in close to the otoscope and position your ear to look through the magnifying glass. So, dito katong circle dito sa otoscope. And then, inspect the tympanic membrane for color, position of landmarks, intactness of drum. And then, if unable to visualize, apply more traction on the ear. Do not move the otoscope or clear the canal from the cerumen. So, una siya ang atong otoscopic exam.